In many industrialized countries, some workers earn a lot more than the annual average salary of $54,132. The 25 highest paid occupations all earned an average of 6 figures annually, each above $120,000, and many of the top-paying jobs are in healthcare. Anesthesiologists, orthodontists, and physicians are among the top-paid workers in the U.S. and all make a median salary of $208,000. According to data from the Bureau of Labor Statistics compiled by U.S. News. Due to the unprecedented levels of burnout and attrition that the COVID-19 pandemic has accelerated, healthcare organizations are currently experiencing a staffing shortage across the industry. As a result of higher-than-usual turnover, employers in the private health sector have pushed up salaries to retain existing staff and attract new employees. In all, more than half of the jobs in the top 14 require a doctorate degree or are within the medical field. Other top-paying jobs that generally require just a 4-year degree include roles in IT, sales and marketing, and business. Here are the 10 best-paying jobs of 2023, according to U.S. News & World Report. 10. Pilot. Pilots fly and operate aircraft like airplanes and helicopters for airlines, private corporations, law enforcement agencies, and the military. They also prepare the aircraft for flight, which includes ensuring there are no mechanical defects with the aircraft, verifying that scheduled maintenance is done and any repairs are complete, and checking the route of flight as well as departure, destination, and alternate airports to make sure the flight is safe for weather conditions. Pilots also make sure the aircraft is properly balanced with passengers, cargo, baggage, and fuel. 9. Pediatrician. Pediatricians are doctors concerned with the physical, emotional, and social well-being of children from infancy to young adulthood. Although it is a specialty in itself, pediatrics also has multitudinous subspecialties ranging from neonatology, oncology, and hematology to developmental behavioral pediatrics and psychiatry. Those who choose to be pediatricians have to love being around children and advocating for children's issues. 8. Nurse anesthetist. Nurse anesthetists can use a number of intravenous drugs and inhaled gases to administer general or regional anesthesia. So surgeons and other physicians can complete procedures with little to no discomfort for the patient. Modern anesthesia has come a long way from the chloroform administered by the first nurse anesthetists in the Civil War. Anesthesia is safer today than it's ever been. You might wonder what the difference is between a nurse anesthetist and an anesthesiologist. One way of answering is through education. Nurse anesthetists are registered nurses who specialize in anesthesiology with at least 1 year of critical care experience and a master's degree, which usually takes 2 years to complete. 7. Psychiatrist. Psychiatrists are physicians who diagnose, treat, and work to prevent disorders relating to the mind and mental health. Having undergone medical school and psychiatry residency programs, these professionals are equipped to understand the complex relationships between ailments of the mind and body. They are also trained to evaluate the entire spectrum of a patient's health, make a diagnosis, and design a treatment plan. Patients might suffer from mental health conditions such as schizophrenia, bipolar disorder, and depression and receive a form of treatment known as psychotherapy. A fancy word for meetings in which a patient discusses his or her moods, problems, and feelings with a psychiatrist. Psychiatrists can also prescribe a wide range of drugs or even recommend hospitalization. 6. Physician. Physicians, also known as primary care doctors, are a patient's first stop when flu symptoms arise, an irregular mole or lump appears, a headache won't subside, or any number of other health questions come up. Physicians also see their patients when they're healthy for annual checkups, where they complete an exam and order tests to help catch health problems early on, or even prevent them before they start. Physicians are trained to take a patient's medical history and order tests to identify any irregularities. Based on the exams and test results, physicians might prescribe medication or a treatment plan. They also answer questions patients have related to their health and offer advice for healthy living. 5. Orthodontist. Orthodontists are dental specialists who concentrate on fixing irregularities in teeth and jaws. They straighten teeth and help correct problems such as overbites and underbites. If you've ever had braces or a retainer to straighten your teeth, you can thank your orthodontist for creating a corrective treatment plan specifically for your needs. It takes many years of higher education to become an orthodontist, but it is the most rewarding career I can imagine. 4. Surgeon. Surgeons operate on patients who suffer from injuries, diseases, or deformities. These professionals can train toward becoming general surgeons, or they can choose a specialization, such as orthopedic, neurological, cardiovascular, or plastic surgery. In the surgical specialty, there's stress around the corner all the time, and you have to be prepared for that. 3. Obstetrician and gynecologist. Obstetricians and gynecologists bring new life into the world and care for the spectrum of women's reproductive health. Obstetrics is the surgical field that deals in childbirth, whereas gynecology is the field of medicine concerned with women's health, especially their reproductive health. One can be a gynecologist and not an obstetrician, though one cannot be an obstetrician without being a gynecologist. OB/GYNs see patients in physicians' offices for routine, well-woman exams, which could include contraceptive management and HPV screening. 2. Oral and maxillofacial surgeons. Oral and maxillofacial surgeons perform surgeries on the face, mouth, and jaw. These professionals are dentists with at least 4 years of additional surgery training, so they can do everything from treating facial traumas to fixing cleft lips. They can diagnose and treat patients with head, neck, and oral cancer. They can even administer anesthesia and perform cosmetic surgeries, such as facelifts. But even though their specialty is specific, the technology used to treat and operate on the face, mouth, and jaw is constantly evolving. 1. Anesthesiologists. Anesthesiologists are the physicians responsible for administering general or regional anesthesia, which allows surgeons and other physicians to complete invasive procedures with little to no discomfort for the patient. Anesthesiologists also closely monitor a patient's vital signs and critical life functions before, during, and after a surgery, making rapid decisions on limited data when required. To say that the profession is stressful is an understatement. More than 150 years ago, ether, the first anesthetic, was hailed as the greatest gift ever made to suffering humanity. Today, the drugs are different. Thanks for watching and subscribe to our channel for more content.